Can cancer be cured by vaccines? The truth about cancer vaccines. Have you ever wondered if a simple vaccine could one day stop cancer? It sounds almost too good to be true. We already use vaccines to prevent diseases like measles, polio, and influenza. But what if vaccines could also prevent, or even help treat, cancer? The answer is more fascinating than most people realize. Today, scientists around the world are developing cancer vaccines that could transform the future of oncology. Some vaccines already prevent certain cancers, while others are teaching the immune system to hunt down tumors that already exist. But can a vaccine actually cure cancer? Let's explore the science. First, it's important to understand that not all cancers are the same. Cancer is not caused by a single virus or bacteria. Instead, it includes hundreds of different diseases that develop when normal cells acquire genetic changes and begin growing uncontrollably. Because every person's cancer is different, creating one universal cancer vaccine is far more difficult than creating a vaccine against a single infectious disease. That is why scientists have developed different types of cancer vaccines for different purposes. The first type is called a preventive cancer vaccine. These vaccines don't attack cancer directly. Instead, they prevent infections that are known to increase the risk of certain cancers. One of the best-known examples is the human papillomavirus, or HPV vaccine. Persistent HPV infection can eventually lead to cervical cancer, as well as several cancers of the throat, anus, penis, vulva, and vagina. By preventing HPV infection, the vaccine dramatically reduces the future risk of developing these cancers. Another important example is the hepatitis B vaccine. Chronic hepatitis B infection greatly increases the risk of liver cancer. Preventing the infection also lowers the risk of developing liver cancer later in life. These vaccines don't cure cancer, but they can prevent many cancers from ever developing. The second category is called therapeutic cancer vaccines. These are very different. Instead of preventing cancer, they are designed to help treat patients who already have it. The goal is to teach the immune system to recognize cancer cells as dangerous and destroy them. Normally, cancer cells are difficult for the immune system to detect because they often resemble healthy cells. Therapeutic vaccines try to expose the tiny molecular differences that make cancer unique. Once immune cells learn to recognize these targets, they may attack cancer cells more effectively. Several therapeutic vaccines have already been approved for specific cancers, while many more are currently being tested in clinical trials. One of the most exciting areas of research involves personalized mRNA cancer vaccines. Unlike traditional vaccines that are identical for everyone, these vaccines are custom-made for each individual patient. Doctors first analyze the tumor using advanced DNA sequencing. They identify unique mutations called neoantigens, special molecular fingerprints found only on that patient's cancer cells. Scientists then design an mRNA vaccine carrying instructions for those specific neoantigens. After vaccination, the immune system learns to recognize these unique cancer markers and may launch a more targeted attack against the tumor. Early clinical studies in cancers such as melanoma have shown encouraging results, especially when these vaccines are combined with immunotherapy. However, research is still ongoing. Despite the excitement, cancer vaccines are not magic cures. Not every patient responds the same way. Some tumors hide from the immune system. Others create an environment that suppresses immune activity. Every person's immune system is also different. Researchers continue working to improve vaccine design, identify better targets, and combine vaccines with treatments such as checkpoint inhibitors, targeted therapies, chemotherapy, and radiation. The future will likely involve combinations rather than a single treatment alone. Scientists are also exploring artificial intelligence, digital twins, and advanced molecular analysis to help identify which patients may benefit most from cancer vaccines. As these technologies improve, treatments could become increasingly personalized. Instead of treating every patient the same way, future cancer care may be tailored to each individual's unique biology. That represents one of the biggest shifts happening in modern oncology. So, can cancer be cured by vaccines? The honest answer is not yet. Some vaccines already prevent cancers caused by certain infections. Therapeutic cancer vaccines have shown promising results for some patients. Personalized mRNA vaccines are opening exciting new possibilities. But researchers are still learning which patients benefit most, how to make vaccines more effective, and how best to combine them with other cancer treatments. The future is incredibly promising, but there is still much work to do. Every year, scientists make new discoveries that bring us closer to more personalized, more effective, and less toxic cancer treatments. And while no single breakthrough has solved cancer, each new discovery adds another important piece to the puzzle. Thank you for watching. If you enjoy evidence-based cancer education explained in a simple way, please like, subscribe, and turn on notifications so you don't miss our next video.